bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers. Our topic today is patient-centered medical home health care. Here to discuss it with us is Eva Matuszewski, the CEO of Medical Network One. Thank you so much for joining us today.
Thank you.
What exactly is patient-centered medical home health care?
It's a new model of providing primary care services to patients in a physician's practice where the patient becomes the focal point. It's no longer the physician or the practice itself that is the nucleus of that care. And what it means is patients have the ability of accessing teams of individuals that work with them, nutritionists, dietitians, exercise specialists, certified diabetes educators, and all services are done within the framework of a home, the physician's home, that new practice that we want patients to come to.
Can you give me a real-life example of how this method might be different from, say, the traditional method of walking into your doctor's office for a visit?
First of all, when you call to make that appointment, you are asked when you would like to come in, and every effort is made to accommodate your need. When you do come in to see the physician, his services are bolstered by a team of specialists, which means if you are in need of mental health services, those are available right there in the practice. If you are in need of an exercise plan, for example, that's something that is available in that practice also. Plus you have access to things such as electronic prescribing. You have access to electronic consults and other ways of communicating with your physician. And the recalls that you generally are accustomed to receiving from health plans are now generated by that physician and that practice team.
What are the major benefits? Obviously, I can think of a lot for the patient, certainly more efficient. You're getting a better overall health care, but I would imagine there's a cost savings involved. It's better for the physician, for the insurance companies, for everyone.
Well, let's be realistic. We want this to be a patient-focused organization, so if you know the patient as a whole, if you understand the ins and outs of that patient's condition, you're more apt to treat it effectively from the front end as opposed to waiting until the tail end. In other words, you're anticipating. You know what the prevention needs are. You know exactly what the disease spectrum is for that patient, and you're prepared for it. You become a prepared, proactive physician, and you also have a prepared, proactive patient in that relationship.
Are more and more physicians in Southeast Michigan using this method in other parts of the state, or how would somebody go about finding someone if they like this idea of this new type of healthcare?
Something relatively new in the state of Michigan. It was firstly recommended and supported through an initiative through Blue Cross and Blue Shield of Michigan through the Physician Group Incentive Program, and they were the ones who identified this as a possible source and a possible way of allowing patients to return to their physicians, their primary care physicians. More and more physicians are beginning to learn about the patient-centered medical home, but as with anything, the question is, what is the business case for it? In our evaluation, it's simply doing the right thing for the right reasons at the right time, making sure that patients are treated appropriately, reducing the amount of ER visits, reducing the amount of urgent care visits, and thereby also reducing the amount of time spent as inpatients.
A lot of people may not realize right now Michigan is in a little bit of a crisis. There's not as many primary care physicians in the pipeline. There is a shortage out there. Might this new approach be a way to attract new young physicians into the field of primary care?
It's exactly what several task forces have identified as a way in which to recruit and retain younger physicians or new physicians coming into primary care. The biggest challenge any physician has as he or she is entering that workforce is the large volume of debt due to scholarships or due to loans that they took to go through medical school. What happens at this point in time is you go into a specialty where you are making more money.
A lot more money. So lots of benefits, it sounds like, could be at least part of the solution for the future of improving health care. Thank you so much for joining us today.
Thank you.
Today's Comcast Newsmaker was the CEO of Medical Network One, Eva Matuszewski.